So the first of the 4 intervention strategies is upstream prevention. So upstream prevention strategies really try to address the root causes of health issue or behavior. We're trying to boost protective factor and minimize risk factor. A good way to illustrate that is using the river parable. So let's say that we are walking by the side of the river. Suddenly we see someone in the water drowning, so we jump in and we try to save them. And then we realize that we have a second, a third, a fourth person drowning in the river, and we will not be able to save them all by ourselves. So instead, we try to figure out, why are people in the river and drowning in the first place? We go upstream and realize that there is a place where people try to cross the river and they often get caught in the current, causing them to drown. Easy solution, you build a bridge. So you minimize the risk factor, being trying to cross at a specific space that is unsafe, by building a bridge. And so people can cross the river safely. In the case of substance use here, we can easily transfer that parable. One way to do this, one exercise to prepare you for upstream prevention strategies, is to use the 5 why exercise. So basically, we will be asking why 5 times to a specific issue. Example, so let's say we have a friend going to parties every weekend, and every time they drink so much that they end up in a coma, they don't remember their night, and really they go to an extent where they always end up in a coma, not remembering, having the worst hangover. So why is that person always going to that extent, not unable to drink only 1 or 2 drinks? So why are we doing that? Well, our friend here is actually pretty uncomfortable in social situation. So when they are in big group like that, they do want to be in big group to follow the other, but when they are in these situations, they tend to drink to kind of forget or to inhibit their social anxiety. Okay, so why do they have that social anxiety? Well, our friend here has been bullied pretty much their whole school life. So really, although they want to make friends and they want to be in social situation, they are really uncomfortable because they are scared that they will be bullied again. Okay, so why were they bullied in general? Well, our friend here tend to dress differently than the other kids. Why are they dressed differently? Well, their family is actually coming from a lower socioeconomic status, and so doesn't have much money even for food, so let alone have brand new clothes. So they share clothes from one sister, one brother, one sibling to another, and that really created that aspect where people were bullying them and laughing at them. So see, we asked why 5 times here, and we were able to go from they drink so much that they go in a coma to they actually come from lower socioeconomic status and have faced other issues sorry, throughout their life that could lead to this behavior. And so we also identify areas where we can implement strategies, having bullying intervention, making sure that they are safe, making sure that we might do a training in class or something, maybe providing them with new clothes or helping the family to have at least food that they can put on the table for all their children. So really, just by doing this exercise here, we were able to identify a few places, a few protective factor and risk factor that we can boost or minimize in order to overcome this situation. Obviously, here I did this example in like 2 minutes. I've done it before, so it was pretty easy for me to go from one to another. In real life context, it might be more difficult, but try still to do this exercise. You can even ask youth themselves, ask your colleagues, really do the exercise of asking why and trying to get to the root cause rather than just staying with that behavior itself. Often, upstream prevention strategies are not explicitly linked to substance use itself. some example could be to have extracurricular activity after school, so that youth are still engaged for a few hours after courses, and also that it fostered sense of belonging. It could be to invite youth to decorate a room so that they can have a safe space to talk together and hang out. It could be to encourage work and volunteering initiative so that youth can get involved and have a sense of purpose. So see, these do not have much to do with substance use itself, but they can actually speak to other root causes and have an impact ultimately on substance use itself.